So, good day, sir. Today I'm going to demonstrate the prenatal care and LEOPOLD'S maneuver. So, equipment, um, tape measure, um, mother-baby book, tetanus toxoid vaccine, 3 cc syringe. Next, procedure. Um, Identify the client and explain the procedure to prevent errors. This enhancing client to be cooperative and fund his confidence. Second, assist client's health history, which includes personal, family, social, and social, previous obstetrical and present obstetrical data. Information gathered by health care provider will help establish baseline data and identify the teaching needs. Next, assess clients' needs, knowledge, and on guidelines for health, pregnant, and anteprenatal and antepartal care. Provide baseline data to identify teaching needs. Serves as baseline data for succeeding prenatal care. Next, review plans for anteprenatal care visits, examination, and laboratory findings to serve as baseline data for succeeding prenatal care. So next, monitor vital signs of the client, um, provide baseline data or future comparison and identification of factors and may place the client at risk for problems. Next, measure height on initial visit and monitor the weight and succeeding visit. Weighting is an important part of each prenatal examination. Gain or decrease in weight will affect pregnancy. Next, conduct physical examination. Begin assessing from head to toe to come with the general impression of women's health and well-being. Next, perform abdominal examination. Um, 8. Instruct the client to empty or void her bladder to promote comfort on the part of the client. Next, position the client in dorsal recumbent. Proper positioning relaxes both mother and baby. It also facilitates the easy location, presentation, and lie of the fetus. Next, drape the client and expose the abdomen from level of the sepoid process down to the symphysis pubis to provide privacy. Next, measure the fundic height using tape measure starting at 0 centimeter to determine the gestation and growth of the fetus. Next, the centimeter side of tape measure must be facing the abdomen while inch side is facing the examiner to prevent bias. Next, locate the highest point of the fundus. Leave one hand in place and secure the end of the tape measure to the fundus. Measure down to the top of the symphysis pubis to measure the fundic height correctly. Next, document the measurement in centimeter to compare with the calculated gestation. Next, perform the LEOPOLD'S maneuver to assess the condition and fetal presentation. Next, warm 2 hands rubbing one against the other before placing them on the abdomen. This use of warm hands during the palpation prevents tension and hardening of the abdominal muscles, favoring good results. Next, perform the four maneuvers. During the first three maneuvers, the examiner stands at the side of the client bed and faces the client. The position favors accurate performance of the maneuvers. Next, first maneuvers, fundal grip with both hand palpate over abdomen and fundus. For A, consistency, head is round, hard, bridge is well defined. Mobility, head moves independently, bridge less mobile, to determine the fetal part lying on the fundus. Next is second maneuver, umbilical grip, with both hands moving down, palpate the side of the uterus from the top to bottom. One side smooth, hard, resistant surface, back, knees and elbows. Other side, angular modulation to determine the fetal back. For fetal heart tone, usually found in the left quadrant. Next, third maneuver, Polling's grip. The right hand over the symphysis can identify presenting part by grasping lower abdomen with thumb fingers. Assess whether the presenting part is engaged in the pelvis. If it is engaged, it will not move. If it is soft, it is the back. To determine engagement of the presenting part. Fourth maneuver, pelvic grip. The nurse alters position by turning toward the patient's feet. With both hands, assist the descent of the presenting part by locating the cephalid of brow. Place your fingers on both sides of uterus with about 2 inches above the inguinal ligament. Press downwards and inwards. If the fetal back is palpated, it needs no obstruction. The other hand will meet the obstruction. The fetal brow is palpated. So to determine the degree of flexion of the fetal head, reposition the client to number 22. Reposition the client to make the client feel uncomfortable. Number 23, administer tetanus toxoid vaccine during the recommended schedule. 8, for the TT1, gives as early as possible. TT2 after a month later. TT3 at least 6 months later. TT4 at least 1 year later. Next, the TT5 at about 1 year later after TT4. Prevents both the mother and newborn term tetanus. Number 24, administer iron folate supplement until the second month postpartum to regain the iron lost during childbirth. Number 25, administer malaria prophylaxis to all pregnant women in endemic areas as ordered by the doctor. Give 2 tablets of chloroquine phosphate, 250 mg every week for the duration of pregnancy. women are most likely to develop malaria when pregnant. Malaria can cause miscarriage, premature, premature labor, small babies, and stillbirth. Number 26, provide, uh, provide and promote teaching on good nutrition, personal hygiene, and enough rest and sleep to ensure an optimum environment for health, growth, and development. So next, discuss the client, her expectations about pregnancy, which includes the danger signs of pregnancy, labor, delivery, and impact on the family. Psychological assessment is important to assess the client in identifying areas of need to ensure the optimal fetal growth and development. So, number 28, plan with the mother, the preparation for breastfeeding the baby. Rationale to know the advantages of breastfeeding to newborn. 29, discuss the importance of prenatal and subsequent visits for follow-up care. So magandang araw po ma'am, susukatan ko na po kayo ng Pundal High. Gusto niyo po muna bang umihi muna? Buksan ko lang muna. So, ma'am, i-palpate ko na po yung kanyo para malaman natin kung saan banda yung ulo ni baby. Diyan ka?